Okay, so here's part 3 of week 8. We have just some splints, pictures of splints around arthritis to give you an idea. We're talking about that. Then we're going to get into Dupuytren's and trigger fingers and some treatments for those. These are the silver ring splints. Think you're familiar with those. Think you made one of those oval 8 splints, with Carolyn, or you were supposed to make one with Carolyn last year. They're pretty cool. These are kind of stylish. They don't look so medical, and we talked about that in context. And they can kind of bring you back into neutral. Can be really helpful to increase function, that sort of thing. Prevent deformity. Here's a thumb spica for the CMC arthritis. This is a hard one. You can usually use the soft one at night. We talked about, a soft one during the day, a neoprene one during the day when you're doing activities, and maybe the hard one at night, generally speaking. Here's a long thumb spica one from very evolved CMC arthritis. These are for the ulnar drift, trying to bring it back more to neutral. Joint protection, check out the joint protection ideas. It's a good resource for you if you're dealing with that with some of your clients with arthritis. Dupuytren's contractures. What are they? They are kind of like a growth along the tendon pathway on the hand, the flexor tendons. Just all this tissue kind of starts to build up. What causes it, they really don't know. It's kind of idiopathic, kind of like the frozen shoulders. Your body starts creating this excess tissue along the tendon pathway, and it becomes very visible. It just starts to pop right out like that. Seems to be more common with Northern European descent. Really no known treatment to get rid of it. You can kind of manage it, especially if you catch it early on. They do surgery with mixed results. They have different things where they inject this treatment into it, kind of breaks up the tissue. And it goes through these stages, these grades 1 through 3. See, it's starting to build up here. It's more prominent. And it pulls that digit, usually it's the middle digits, into a flexion, contracture kind of deal. And then this 3rd grade, it's fully into flexion, very difficult, impairing function. And usually in this case, they're getting surgery and they release it. And sometimes after the surgery, it just comes right back again and gets contracted again. Splinting, as you suspect, you splint it into extension. Splinting can be quite successful if you catch it early on. In terms of managing it, you cannot get rid of it. It's kind of always there, lifetime deal. But if you can splint it into extension, constant stretching into extension can help prevent it from, ending up like this sort of thing. And then we have the trigger finger, which is very similar to the Dupuytren's. Kind of get confused, but it's more of a swelling than a scar tissue buildup. See how there's no scarring, there's no buildup of tissue along here, but there is a lot of inflammation. Usually around the MP joint, it gets inflamed. As it gets inflamed, it does that same kind of pattern of pulling it into flexion, and then kind of catch. What they call it a trigger finger. You can actually hear it clicking at times when it's advanced, and cause it to kind of stick, and it sticks and releases, then eventually just sticks all the time, and it sticks into flexion. You can see it here starting to swell, starting to stick along that. So that the tendon, which is kind of like a string through a pulley, gliding back and forth, as it starts to swell and push through there, it catches there and kind of it pulls it into that flexion. How do you treat that? Again, the same kind of idea. Into extension. This is just a basic gutter splint into extension. This they've shown to be more effective. It's down by the MP. So this repeated MP flexion of your knuckles. Think of your knuckles, those big MP joints, constantly flexing. You're flexing them all day long. If you can prevent that, the idea is you're going to reduce the amount of inflammation because you're not flexing the MP so much, reducing the load, and you can prevent the deformity and kind of get the symptoms to go away, at least temporarily. Just general FYI, diabetic hands. There's a lot of these things we're talking about are very related to diabetes, which gets back to that theme of the space and flows, especially blood circulation, healing of the tissue, neuropathy. But diabetes is linked to Dupuytren's, trigger finger, scleroderma, which is a form of arthritis, carpal tunnel, the frozen shoulder we talked about, just general joint stiffness. It's kind of bad news. And then kind of flipping over to the, can do that, flip over to the treatment box to finish that up. Here is the Dupuytren's. This is the flat test. We'll do this in the lab, but it's basically just putting your hand, palm down on the table. Can you flatten it all the way? If you can flatten it all the way, you're good. If you can't, if it starts to bump up in those middle fingers, you may have a Dupuytren's kind of thing going on. How do you treat it conservatively? We talked about extension, extension, extension. Surgery, how do you treat it post-surgery? Wound management, edema management, icing, that sort of thing. Contrast baths, restricting activity, splinting into extension. And then 2 to 4 weeks post, once the doctor gives the okay, taking those sutures out, and then working those tendons, getting them gliding again, so it doesn't get, scar tissue doesn't build up and doesn't get inhibited. Blocking exercise, which is basically isolating the joints. So they're isolating the DIP there. Tenodesis, remember that? That's just kind of going into passively from flexion into extension to get more joint motion again. Basic kind of stuff for the Dupuytren's disease, and then for the trigger finger, the digital tenosynovitis. It's right around that A1 pulley, which is right around the MP joint. You see that ring finger. I talked about that snapping. It's extension. Again, you're losing extension of the digit, usually that middle finger. How do you test this? We'll get into this in the lab, but if you palpate, take your hand and you palpate on the palm side of your MP joint and just flex it back and forth, you'll feel a snapping in there. You may have an early stages of a trigger finger, or maybe a false positive. It's not a definitive test. How do you prevent this? You want to avoid the flexion of the MP. That's what really seems to aggravate it, flare it up. This splint can help you prevent that. Andrea Sumberger talks about just using even a Band-Aid. It just kind of inhibits you from flexing your MP all the time and can help calm it down. Gutter splints, that image on the PowerPoint helps with that. Massaging, hook fist, kind of avoiding the MP flexion. And again, they do surgery for that. They release it. More similar kind of stuff, getting it back moving again after the surgery. And here's a down and dirty for the CMC arthritis we talked about. All right, that is that for this session.